Hello, this is Dr. Grande. Today the question is, what is conversion disorder? Conversion disorder is a mental health disorder where we have this incompatibility between particular symptoms and medical diagnosing, meaning medical practitioners in a case of conversion disorder were unable to find any reason for the symptoms. And these symptoms aren't better explained by another disorder, and they lead to distress in areas like work and socializing.
So what are the symptoms associated with it?
The symptoms we see with conversion disorder you could think of as being in two categories, motor and sensory. So if we look at the motor symptoms, this would be weakness, paralysis, tremors, difficulty walking, trouble with balance. So for the sensory type symptoms, you would have like numbness or trouble with vision, which could lead all the way up to blindness, trouble with hearing, which could lead all the way up to deafness, and trouble speaking, which could include being unable to speak.
That sounds like somebody could be pretending those symptoms. Isn't there a disorder already associated with that?
Yeah, with conversion disorder, we're not talking about when somebody's pretending. A lot of times we think of if somebody's faking the symptoms, that would be factitious disorder. And usually factitious disorder we think of when there's no clear motivation, there's no clear reason to pretend their symptoms. And there's a V code in the Diagnostic and Statistical Manual for a condition called malingering, which really isn't a mental health disorder, but malingering would be where there's a clear motivation, like somebody has a reason, like financial gain, to pretend that they have symptoms. Conversion disorder, there's nothing like that. People with conversion disorder aren't trying to gain anything, and they're not pretending. The symptoms are real.
So if there's no gains and they're not pretending, then what's going on in their brain for something like that to happen?
Well, this is a bit of a mystery with conversion disorder. So again, there's no medical explanation. There's nothing structurally wrong with the brain. There's no chemical imbalance or injury that occurred that can be seen on a scan or some sort of test. With conversion disorder, it's just a change in functioning, a decrease in functioning, and we really don't know what's going on at that level. There's no medical explanation for this disorder.
So if there's no medical reasoning behind this, then what's the mental health explanation?
So this comes down to the theory. We have a lot of theories about what causes conversion disorder. And again, there's no medical explanation. There's nothing we can see. So we have these different social and cognitive theories. One is that there's unconscious drives. And these unconscious drives become repressed, and that repression results in the expression of these symptoms in conversion disorder. Another theory is that this is a matter of behavioral shaping, that the environment shapes behavior, and these conversion symptoms have a purpose, and they come about because of the shaping. There's also another theory around a cultural explanation. In cultures where the expression of emotions is not preferred, there's this idea that the conversion symptoms are a way of communicating, that the conversion symptoms come about to allow somebody to communicate emotions they can't express. But really with mental health causes, we don't know. There's, again, a mystery around what leads to conversion disorder.
So how is this treated?
Well, the treatment of conversion disorder you could think of as coming in a few categories. For a number of people, particularly with acute symptoms of a conversion disorder, simply finding out that there's nothing medically wrong leads to improvement much of the time. For other individuals, we see sometimes a progression where other neurological conditions come up. So there's a lot of different courses somebody could take. They could get better right away just by hearing that everything's okay medically, or we see this associated with other conditions. So the treatment, if the symptoms don't go away spontaneously when finding out that nothing's medically wrong, would oftentimes be something like cognitive behavioral therapy, where somebody would work through the evidence and the logic behind the symptoms and ways to manage them with self-talk and other cognitive methods.